Inflammation is really interesting because if you think about it, the blood vessel is almost like a tube. Think about it like plumbing. And it has an inside lining. And I liken it to the skin. And so if you imagine, we want the inside lining of our blood vessels to be as smooth and as unbroken as possible because we want the blood to flow across it, and we don't want there to be areas of turbulence or areas where clots or irregularities may form. The first development of heart disease is when we develop inflammation of this inner skin of the blood vessel. Now, when the area becomes inflamed, think about it like if you had a cut. It's much more easy to get an infection if you have a cut on your skin. You can get dirt in there. In the same way, if you have inflammation of the inside of the blood vessels, it's much easier to kind of get cholesterol depositing in those nooks and crannies. Once you start to get deposits of cholesterol, you can begin to form what we call soft plaque. And that plaque can start to sit and expand under the skin of the blood vessel. Also, if you have things like diabetes, if you're a smoker, high blood pressure, all of those are things that can cause trauma to the blood vessel and can lead to increased inflammation. Once that inflammation happens, you can start to develop plaque, and over time that plaque can increase to the point where it may block the blood vessel enough to develop symptoms. One thing that I do tell people, though, is that plaque is not deposited like cement. Actually, we can improve, we can reverse, we can reabsorb plaque. So doing things to decrease the inflammation, controlling your cholesterol, controlling your blood sugar, exercising, lowering your blood pressure, having a heart-healthy diet, all of these things are things that can help heal and help prevent your risk of heart disease being a problem in the future.